I'm here to answer your question. Question is, what's the recovery like from replacement surgery? I'm assuming you mean disc replacement surgery, and I assume there are a lot of potential complications. So the recovery from disc replacement surgery is usually pretty quick. So in our setting, you're only in the hospital maybe one night. You're up out of bed within an hour or two after surgery and starting your rehabilitation almost right away. So we recommend doing physical therapy pretty early, within a couple of weeks. In terms of return to function, we'll let you go back to sports sometime between 3 to 6 months after the surgery. Complications, any surgery has complications. The most common complication is not really a complication, it's unrealized expectations. So in other words, we tell our patients that most of the time, maybe even up to 80 to 90% of the time, their pain and function will be improved. Will it be 100%? Probably not. So that's kind of where we're at in terms of that. Unrealized expectations. You don't get as much pain relief as you hoped. But that goes with going into this type of procedure with your eyes wide open. The other complications that people talk about are complications from the exposure to the front of the spine. There are some big blood vessels there, and we use a general surgeon or a vascular surgeon or an approach surgeon to be on our team to deal with those situations should they occur. They're rare, but you certainly want your whole team there.
So this is a question that I could answer from personal experience, as I've had a disc replacement done on myself approximately a year and a half ago. So the recovery, I tell patients the first 2 weeks, you should plan on just kind of laying low, kind of relaxing around the house, do a little bit of walking every day, several times a day. You're walking from day one, but you're not going to want to spend a lot of time on your feet. You're going to want to go for short, 5, 10, 15-minute walks for the first couple weeks. Most people can get back to a relatively easy job after about 2 weeks. And then I let patients go back to start a gentle exercise program at 3 weeks post-op, which includes some basic ab work, some leg work, a little bit of upper body work without flexing the spine. So no bending for the first 6 weeks. I put most patients in a brace to help remind them of that. So at about 6 weeks, you're feeling pretty good. You're not 100% though. Your back may feel a little bit unstable still, not much pain, but feeling pretty good. And then between 6 weeks and 3 months, you're really getting to that close to full recovery feeling. But some patients don't really feel perfect for out to 6 months. So when someone asks me what's the recovery, well, it really is a gradual thing that may take up to 6 months for full recovery. But you're feeling pretty good and back to almost everything at around 6 weeks to 3 months.
The thought of having a lumbar disc placed in your spine can be a terrifying one, especially when you consider that you're going through your abdomen to place an implant in your spine. Some patients think we're going to take all of their organs out, put them on the side table, do the surgery, put everything back in. In reality, the opposite is true. We do these operations now through incisions that are 1 to 2 inches in length, and the operation itself lasts less than an hour. It's still an invasive procedure, and there are risks associated with it because you are going through the abdomen and dealing with critical structures in front of the spine. For this reason, most of these operations are done with a spine surgeon and a vascular or general surgeon. The vascular or general surgeon typically makes the incision and exposes the spine by moving the organs and the blood vessels aside. The spine surgeon then goes in, removes the disc, and places the new artificial one. Typically, the operation takes less than an hour, and most patients go home within a few hours afterwards. We very rarely do these operations as an inpatient procedure, and it is very rare for us to keep patients overnight. The risks of surgery depend upon the experience of the surgeon who's doing the operation. We've had over 10 years of experience doing the operation, and as a result have done many procedures. Our risks with this operation are less than 2% and include things like infection, bleeding enough to need a blood transfusion, loss of neurologic function or nerve damage, injuring the abdominal organs or the blood vessels in front of the spine, have the implant fail either mechanically or because it moves or displaces. You can also have complications associated with general anesthesia. That can include allergic reactions to medications, pneumonia, heart attack, blood clots that develop, and even dying from the anesthetic itself. Even though these risks sound terrible, the actual incidence or the risk profile is very low, like I said, 1 to 2%. So in the right hands, this operation is a very safe and reproducible one, and for most patients, they go home the day of surgery.